So one of the things that we see happening right now, and it's across the board, it doesn't matter whether it's a public sector client, an academic client, or an industry client, they have a communications team that sits over here. They have their whatever team that's doing the work, and they sit over here in some functional area. And when this team gets something that they think needs to be communicated, they send it over to the comms folks, and the comms folks do their comms business. When you're trying to create change, that's great for reinforcing status quo. When you're trying to create change, you need to be communicating all the time that this change is happening, because we all as people need to hear and know about things many, many times before we really take them seriously. And so we build in wraparound communications into all of our projects. So
welcome to Public Health Careers. I'm your host, Emory Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Hey, this is Meaghan Kennedy. I'm the founder of Orange Sparkle Ball, and you're listening to Public Health Careers.
Meaghan, welcome to the show. I'm so excited to meet you. I got to meet a couple of your team members at EPHA a couple of months ago, and I was very enthused about the work that you were doing. So welcome to the show.
Thank you very much. I'm quite excited to be here, and it's great to meet you.
The pleasure is mine. So before we get into anything, how do you identify, and tell us a little bit about your personal background?
I identify as she, her. My personal background. I'm a Michigander. I had to rock my Detroit sweatshirt. And I have lived a bunch of different places in the U.S., but came back to Michigan during the pandemic and am pretty rooted here as well. I think you often go back to the place that was formative for you. So that's a big part of my identity. And then the other big part of my identity is, even when we were talking before we started, you were saying, introduce yourself and kind of who you are. And I never quite know whether I talk about a public health person or a design person. So I would say that a big part of my identity is existing not squarely in a preconceived area, is I think how I would describe myself.
Appreciate the identities, and I love when people say, like, don't put me in a box. Like, I am many things and I will continue to be many things as I evolve in life. Do not put me in a box.
That's me.
Love it. And I guess, like, on that thread, can you talk more about that intersection of public health and design?
I can talk a lot about it. Yes. Do you want me to go like back, why I ended up in that area?
Let's do it.
Okay, that sounds great. So and I may be jumping ahead in some of your questions, so feel free to redirect me if you want to.
Will do.
My undergrad is in physiology, and I've always been like, I don't want to brag, but I did win the science award in my high school. Teasing. But I've always been very kind of focused on science and health, and going to public health school was a very kind of obvious path for me. And it was in the 90s, and HIV was tough. And so my goal was to go to public health school, and I chose Emory on purpose because it was in Atlanta, to go to public health school and basically talk my way into CDC because I wanted to work in HIV. And that I did all of those things, and it all kind of worked out as my plan was. And I got to CDC and was there for 7 years and did a whole bunch of domestic and international stuff. But one of the things that was hard for me, and I think is probably still the case, the pace of the work was very slow. So it was, I would call plodding. And sorry, I have a lot of sun in my eye. The juxtaposition of being in a pandemic and plotting work at the same time was emotionally really hard. And so I started really trying to figure out, like, how do you do this differently? Like, so all of health research work is rooted in the design or in the scientific method, and it's a very I have my hypothesis, and then I do a lot of stuff to test my hypothesis, and I analyze my data, and maybe 3 years later I have an idea of, was my hypothesis right? In 3 years, when you're working in HIV, is a rough timeline. And so I started trying to figure out what is a different way to do this. And I stumbled upon, I'll really be honest, this idea of design thinking, which is really quick, iterative, and directional sort of tests. And I fell in love with it. And so I stopped working at CDC and went to industrial design school at Georgia Tech. I went kind of back to another grad program. And just to really learn, what does it look like to approach problem solving very differently and very much kind of flexibly and on the fly. And so that kind of the juxtaposition of those two pieces of my identity has been the kind of crux of most of my career.
That gives us a good foundation going into the conversation and like taking you through the trajectory of everything that's going on. And I think like the big fundamental question, like asking yourself is like, how do I do this differently? Understanding that the way that things were being done didn't happen at a speed or wasn't iterated and changed at a speed that can really keep up with the condition that was happening at the point in time. Love the idea of design thinking. I think most public health people should learn, most if not all public health people should learn design thinking, because the concept of finding an idea with the community, guiding it, being directional, and then the change in it. I think the iterative process is what's so important. And many times, like as you stated in your story, it might take a long time in traditional ways to get to that. I see you nodding your head. Do you want to add anything to that?
The only thing I will add, I love how you said that. The only thing I will add, and this is a piece I think that I sort of wove in appropriately later on, is the idea of like co-development with the community. When I was at CDC and a lot of the work, we had like community advisory boards and stuff like that, but I would say it was more advisory instead of like in the weeds, kind of like, let's all get in here and design this together. And so really the design thinking process allowed me to understand even like what is a different way to work with the community. So it has layered in kind of my thinking around a whole bunch of things that I couldn't agree with you more. I think every public health person should learn design thinking and really understand it.
Yeah. You've had an extensive career in social entrepreneurship. What should we know as public health audience about what should we know as a public health audience about innovation and okay, 3.
I'm glad that happens to other people too, because I'm
it does. It does. And I feel like when it happens, it makes other people comfortable. So
for sure.
Make you comfortable.
Oh, yeah.
Okay.
Yes.
Okay. 3, 2, 1. What should we know as a public health audience about innovation and entrepreneurship, particularly social entrepreneurship?
I love that question. So I am going to say something that I still have, I have a ton of public health friends and they are my dear friends. I kind of grew up with them. So I'm going to say something that maybe some of my public health friends might get grumpy at me about, but I will say it nonetheless, and I stand by it. There is something about capitalism that is a lever that drives change. And layering in, so that's entrepreneurship. layering in the social piece is great. And frankly, I think every business should be a social enterprise. I think it should be giving back to the community as well as supporting itself. So in the best scenario, that the pursuit of whatever your goal is with your enterprise will provide the lever and momentum you need to keep the organization going. And what I mean by that is if the market is bearing kind of fruit for your enterprise, you keep moving it forward. That could be, you are selling a lot of whatevers. Like for us, because we're an innovation agency, it could be that we're getting new clients or we're getting more clients for what we feel like are the areas of business that we do best or provide most impact. And we can measure impact in a whole bunch of ways. And, to the thing I said, where everything should be a social enterprise, we could measure impact with how much money we made this year. Or we could measure it with one of the things we talk about is how many sectors are we reaching? How many different geographies are we reaching? Anyhow, all of those, there are lots of ways we could talk about how do you measure impact. But to actually answer your question, framing everything around, am I getting feedback that this is something that can move forward or is a viable service, product, whatever. And even if, when I was at CDC, we were providing services to people. We were sort of, if you think of being subsidized by the government, but we could have been taking in are we providing valuable services to the universities, to the public health community, to the other kind of development agencies we were working with. So I think you can frame everything around this idea of social entrepreneurship. And I think it helps you constantly assess, am I a good actor in my ecosystem? And am I providing value in the way that I feel like I should be providing value?
And in saying that, what is typically the pushback that you get from your public health friends?
If you're motivated by making money, then you're not doing the right thing.
And that is an interesting juxtaposition. And I feel like I also lean on your side of things, knowing that there is benefits in capitalism. And to your point, that the businesses that succeed, they succeed because they provide a product that people like. So how can we create more products that people like? And I think to dig a little deeper, as a public health audience, a lot of us care about populations, care about these things, care about communities. So if we don't become the people that become the entrepreneurs, and the people that don't care about people become the entrepreneurs, and that kind of leads to the vicious cycle of the hyper-capitalistic society that we're in today.
Well, yeah, but then we're ceding that ground to people who maybe don't care about the community as much as we do.
Right.
I totally agree. I gathered you might fall on my side of things, but that's just a guess.
Right. I think capitalism as it stands right now is not the most effective system, but it is not a system that's going to disappear. So it's how do we integrate our positive aspects and framing and public health and there's that mindset into the work to really try to shift things, and as well as try to shift the systems and structures and policies that are there so that we can create more foundations for organizations that do good work to improve the social life of people.
Well, and I think straight capitalism is thinking about how much money do you make? But if we think of value more expansively, so how are we providing value? Then we can start having the conversation about, I did this exercise, I don't know, a couple of years ago. I was reflecting on Orange Sparkle Ball had been in business a long time. And I was thinking how many people, how many teammates came in to work with me And then during the course of the time that they worked with me, like bought a house or started a family or that kind of thing. So what is the impact? What value did Orange Sparkle Ball provide to that sort of community of people that have worked in our orbit? And it was just something I was kind of musing on. But, you start defining value much more broadly. And that's just, kind of my teammates kind of value. But if you think of your whole ecosystem, then you can start to have a real conversation about like, all right, value can be described in a whole bunch of ways, but at least you're continuing to have the value conversation.
I like that framing. And yes, as many times we do forget about all those things that happen from people working for us and like what that has done for their lives and how that has enriched their lives and what benefit that is there. So I appreciate you raising that up. You've also had the opportunity to be a judge and mentor for the Global Social Venture Competition at Georgia Institute of Technology. You were a judge for the Southeastern US region of that Global Social Venture Competition for early stage ventures that are addressing some of the most pressing social and environmental issues around the world. What did you learn from this?
I think learned. One, it's real hard to start a business. I think I was reminded about that. I think also I was also reminded of how small the world is, because a lot of the enterprises were existing in different parts of the world or focused, providing their service or product in different parts of the world. And they could have easily been picked up and they could have been scaled globally, I guess is an easy way to say that. So I guess I always like doing things like that. And I've mentored startup founders a whole bunch. That was one example, but in a bunch, and been judges and stuff. I like doing it because it reminds me connecting the dots sort of horizontally is a really important thing. So if this type of approach works, in a small village, will it work in, Africa? Will it work in a small village in Southeast Asia? Maybe not, but we could try it and then start iterating on what are the kind of tweaks we need to make, to sell irrigation systems, for instance, or provide phones so that people who were moving from country to country could work from their phone. On one of the startups was this amazing startup about allowing people to work from their phone to test training data for AI. And I was like, and they had worked out paying, and it was a digital currency that they were using to pay that was, obviously country agnostic. And it was like they had solved all of these problems and created real value to both the people who weren't being allowed to stay in any one place. They were moving around, and there were a lot of different global scenarios about why they were having to move around. But so they'd worked out a way for people to make money, do jobs, provide value for other companies in a B2B way, get paid. It was kind of amazing. That was the one that I thought of right away, because I was like, all of these problems exist all over, and they've basically come up with a solution that they've figured out how to tweak in different locales to provide value anywhere that they can reach people who have a need. Anyhow, it always makes me think about, wow, you can really solve problems, and the problems are very similar. There's like a pattern of these problems, and you can do small tweaks, but a solution here probably has 80% of what's needed for a solution here, and we all too often forget to do that kind of connecting the dots piece, I think.
And you mentioned earlier that you got your bachelor's in physiology. But before we get into that, I want to hear, what does public health mean to you?
Oh, well, I also have a very, very expansive view of public health, which I don't know. I think more and more people are kind of broadening their view of public health. I think it's just sort of well-being for the community, just something very broad. So when I think of public health, I was talking about pondering about how many people had bought their first home or something when they were working at OSB. I think that is public health. We're doing a ton of mobility work right now, and we worked really hard on what is the orange sparkle ball definition of mobility, and it's basically my definition of public health as well, where it's like physical, economic, and social mobility toward a better whatever life, well-being. So anyhow, I have a very broad view of public health.
As we were saying earlier, you were a science prodigy, winning your science competition in high school. From there, you went on to get your Bachelor of Physiology at Alma College. Tell us about that thought process.
I will totally do that. But first, I have got to hand it to you. We just met and you're already teasing me, and that makes me really like you. Awesome. I know I totally opened myself up to that, but I had to. Let's see. I'm trying to kind of put myself back in. How did I decide on physiology? So I ended up going to this small liberal arts school in Michigan, which was great because you could, there's no getting lost like in the, sea of 20,000 students or anything like that. And there was a new program at that college that had these two like super dynamic, but not like personality wise, like dynamic, intellectually dynamic, I would say, young professors. And they were building this human physiology program. And I honestly, I'm very motivated by being around dynamic people, just like that's always been the case. And I probably chose physiology, let's be honest, because they were awesome and they were challenging people, and I worked on a NASA grant. This was a tiny little college, and one of them had gotten a NASA grant, and so we ran this whole study over spring break, which was another thing that was kind of crazy. But I was getting the opportunity to do things that you didn't normally get to do as a 18-year-old. And I was like into it. So it was like, great, human physiology it is. Here I am.
And in following that path and getting that work and doing that internship with NASA, were they like any big undergrad takeaways that you wanted to share with us?
Yes, for sure. I knew because the study that we were working on was we recruited, this is bizarre, but we recruited a lot of like 15, I think, college males. It was only males. And we kept them for 7 days with their head lower than their feet. And that basically approximated what it's like in space. It also gives you a tremendous headache, like for the entire time, because all the blood is in your head. And so there was a lot of these poor guys, and they were my age or like a couple of years older. And I was like, and we were with them 24 hours. So anyhow, doing blood draws, just like a lot of stuff, trying to figure out how to feed them when by the end of the time they didn't feel that great. And I realized a lot of people from my program were going on to like do clinical stuff. And I was not into clinical. I did not want to do, patient anything. I felt like it was a real victory that all of those guys came out of the 7 days still like liking me. Okay. So I was looking for something that was science and health related, but was not clinical care. And so that was what kind of then drove me to public health. And I actually talked to one of those professors a lot about it. And he was like, do you know this thing called public health? And I was like, nah, I don't. Sorry. And so he kind of directed me, got me thinking about it. And then I started figuring out like if I'm going to do public health, I really actually would like to go to CDC because that's like where you do public health, right? And I figured then I better go to Atlanta because I thought I could talk my way in.
Intentional. I like that. And that was going to be my next question. Where did you hear about public health? Because you shared earlier that it was in the 90s, the HIV epidemic was going on, and you really wanted to get into public health. And I guess to your point of learning that you didn't want to do any clinical type work, which I think is very important for people. It's like do the work so you find out what you don't like, so you can then find out what you do like. Many times that is how it happens. And then being intentional and saying, like, I want to get into public health. The CDC is where I can do a lot of public health work. Let me get my master's of public health in Atlanta, where you got your master's of public health at Emory University. Was there any more to that thought process of choosing Emory?
I really did do a lot of research. I applied to University of Colorado and then University of Washington, and I was kind of thinking about should I apply to other places, but I got into Rollins at Emory. And I did some research and I realized at that point, the Rollins building, now they have a bunch of buildings, but was basically right across the street from CDC. And I was like, that's my final goal. That clearly is the place to go to school because I can just like walk across the street. And so it was really, that was the extent of my true research on where should I go. And I even, I got a scholarship to go to the University of Colorado. And I was like, I'm still going to go to Rollins because that was really, I wanted to work at CDC. I wanted that experience.
Yeah, and that's important to think about, like proximity, because just knowing that you are going to be there gives you the chance to have more opportunities to work there, intern there, get jobs there. So it just makes it a lot easier in a lot of logistical ways, as well as like connecting with people and networking with people that are the CDC. Granted, you could do that online, but in person is always great as well. So appreciate you sharing that. Were there any internships or pivotal experiences during your MPH?
I started. Let me say this differently. I did do a couple, they weren't kind of full internships, but I started freelancing as soon as I got there because I had actually, because of my undergrad, I had a ton of research experience. And so it was really easy for me to pick up freelance research jobs. So I was like writing up method sections, that kind of stuff for people, as soon as I got there. So I did an internship because I was too busy, basically. But what I didn't realize and what was amazing is a lot of my classes were people from CDC because I was doing epidemiology. And so a lot of CDC, like MDs, would go back to Rollins and get MPHs. So I was working with, probably half my class worked at CDC. And so I started working, I got a job at CDC after my first year. So I didn't, between like the freelance stuff and then my real job, I did an internship. I didn't do a real internship at all. So I didn't need to. But the one thing that I will say, and I'm kind of going back to something that you said. One of the things that I really realized, and I talked to people, I talked to a ton of students, both design students and public health students. And then we work with a lot of schools. Orange Sparkleball works with a lot of schools. So I'm often kind of talking to students. I took advantage of every opportunity to go to CDC. And it was a lot easier then because the security wasn't quite as big a deal. But we could go to I want to say it was like Wednesday morning. There was some presentation of some public health something. So sometimes it was like a outbreak on a cruise ship, kind of standard, stereotypical public health. Other times it was like some analyses of HIV surveillance or something that was more kind of, statistical methods type things. But I went to every one of those and I made sure to talk to people. Like I didn't just go and sit there. I went and, talked, because it was basically an auditorium full of CDC people. And I was like, this is what I want to do. I better figure out when do I like these people? Do I have anything in common? And how do you get in here? And so I started doing that, my first week at Emory, and in 12 months I had a job.
I love that. And that just speaks to the proximity point that we were making. Like just being at Emory next to the CDC allowed you to be in classes with people who are already working at the CDC, who are coming back for their MPHs, and then also having other opportunities to just go to the CDC, meet people, connect, learn what they're doing, and then from there, being very intentional in making those network connections and then getting that first job, and then the job after your MPH. Before we get to your job after your MPH at the CDC, were there any takeaways from your MPH program you wanted to share with us?
Yes. One, realized that public health people are my people, which was great. My fellow students were from all over the globe, and they had already done, work in different places and were coming back to grad school. And so I would say that's probably my biggest takeaway is I was trying to figure out, like, I knew the clinical people weren't really my people, but I knew that I was like super into science and thinking about, kind of patterns of things. And frankly, public health is like the perfect sweet spot for that. And so I would say that was my biggest aha moment. Like, oh, this is great. I found my people. In terms of the program was very new. I want to say, like, I don't know, I think it was maybe 5 years old or something like that. So it's very different now. Like I was on a panel for new students at Rollins, and they said something about like, well, talk to us about your experience. And I was like, there were barely any people here. Now there are like 3 buildings. So I don't even know that my experience is relevant to you. So I think really just understanding that this sort of global view of understanding patterns and was important to all these other people that were sitting in the room with me was the best thing that ever could have happened.
And after you graduated from your MPH, you became an epidemiologist at the CDC. Tell us about the work that you're able to do there.
It was great. I can't even tell you how impactful that work was. Initially, I went in working on a blood donor study, which was, kind of, one might think not as interesting maybe as some of the studies you could go in on, but I was like looking for any way in. So I was like, great. But we had 18 study sites, and I was really a child. And was in charge of these 18 study sites. And so I was like going, I think they wanted us to go 2 or 3 times a year to each of the 18 study sites. They were all domestic. So it was, relatively easy, but I was traveling a ton, and we'd go, sometimes I would go by myself, 3 to 5 days, something like that. So I want to say I was either 20 or 21. I was like basically on the road in all of these different cities in the US, going to either hospitals, or they were typically affiliated with hospitals or academic institutions. So I like got this really big view of the interface between kind of the public, is a surveillance study, the sort of public health surveillance approach, and kind of real world organizations that were study sites. So that was fantastic. Like it was such a amazing education in how does this actually work. And I was managing budgets and doing budget negotiations with typically like, heads of blood centers or elite researchers from universities. And so that was I think luckily I was too naive and too inexperienced to realize that I should be totally freaked out about like basically having to go head to head in a budget negotiation with somebody who was far more experienced than I was. But I learned all of these things that I use every day in my professional career, and I have used every day since I started doing them and learning them. So it was just this amazing experience. I can ask, yeah, I'll let you ask me more questions about that.
Yeah, I first did like the point of you saying that you were just looking for any door to get into the organization, and I hear that many times with a lot of people that are trying to get into federal government or the CDC. It is like you get in through one door, and then you figure out how to move around and navigate. Because once you're in, it's a lot easier to do that than from the outside, and we never know when opportunities are going to open up, which I think
Yeah.
is very important. Just kind of want to ask because like you're coming out of your MPH program, you're getting thrown into this role. How did you like live up to that and be able to do that work?
I'm tenacious, I think. I just tried to do a lot of critical thinking. So like I was laughing the other day because somebody asked me about what was one of the first things I did when I went to CDC, and answering that quite literally, I think I did budget negotiations like maybe 3 weeks in, and I didn't even know what it was. They were like, well, you have to go to this other office and do these budget negotiations, and I'm like, okay, well, can you tell me like what do I need to do? And they were like, here are all the cooperative agreement applications. They're all renewals. So here's the data on kind of, the number of people they've enrolled, the number of interviews they've done, like kind of the pieces of the study. And here's the budget. And so I was like, okay. So I did this calculation about like kind of the cost for everyone enrolled across different centers. And so I had across, all 18 sites, and I had basically, and I did it by hand, like this bar chart of, kind of our ROI basically, without really understanding that's, business version of that would be an ROI. So I was able to go into these negotiations, and I was able to say like, well, looking at my analysis, it is costing us X amount for every participant you enroll in the study. And, that's in the, top 3 costs for our 18 centers. So we just, we can't keep paying that amount. People were stunned. Like, and it was like WebEx, so it was like some very like clunky video system, and it was they were mostly men, mostly MDs, and they were just like their jaw dropped open. And they were like, well, and they had I think at the time my boss was joking when he said this, but when he sent me to the negotiations, he was like, we really need to cut some budget, and I was like, okay, no problem. So I did. I got a lot of budget, but I came back and he was like, how'd it go? And I was like, oh, it went great. And he was like, did you cut the budget? And I said, yeah, no problem. And he was like, who did you cut it from? Like freaked out. And so I went down and I said, well, this center and this center and this center, because they were the top 3 in terms of cost. And we just it didn't make any sense. So I tried to get everyone more toward a kind of standard cost for enrollee. He ran to his office and was like making phone calls to make sure that I hadn't made people mad. Anyhow, to answer your question, I had no idea what I was doing, but I just sort of jumped in and tried to use some critical thinking, and I really did take literally what they were encouraging me to do, even if maybe I took it a little bit more literally than they did.
I love that. I love that. That is an awesome story, and I think it is the way that we should all try to come in and approach work as we're coming out of school. Is like just doing the things, learning the things, being naive enough to like just challenge what is being said.
Well, and thank goodness I had spent a lot of time doing this analysis And because there was, I mean, I can do an analysis and I can come up with very deliberate reasons why things, database reasons why things need to happen. So there really wasn't much disputing. And thank goodness I was so rigorous about it because I felt totally fine about it.
And that's important as well. That's important as well. Being able to show this is the rationale for why I made this decision and being able to back that up, I think is also essential. So like really doing your work on all ends. That's really awesome. And so you were at the CDC for around 7 years. Tell us
Yeah.
about what does that look like in longevity and how did that go as a journey?
It was both, as I said, like I learned amazing things. I realized, those were my people, all of that. I had some really fantastic mentors who really helped me understand like how to do analyses, how to write, how to publish, all of the kind of things that I don't know that you necessarily get in school. I think you can get pieces of it, but it's hard to get really professionally good at all that in school. I also had some really tough experiences. And I went to work on a study in Kenya about midway through my CDC career. I got detailed to WHO. And I got typhoid when I was there. And then I got super sick. And so I spent about a year really pretty incapacitated. So that was sort of like this weird, I had this career, like domestic kind of blood center where I was just kind of getting my understanding public health, I would say, really understanding surveillance. So it was very epi driven surveillance kind of data, doing analyses. Then I went and worked in Kenya, and that was very much like running the studies and, solving problems on the fly kind of thing. And then I got sick and was kind of assessed my life, I would say, and what it was going to be. And then when I got well enough to go back to work, I didn't want to I knew that like going back to a blood center job was probably not the role I wanted. And I wanted to do more kind of behavioral science driven work because I was like, I don't, surveillance can be a little dry. And so I took a job that was with psychologists and sociologists who were working, and I don't even know I don't know how long the study went, but it was one of kind of the big early studies, the HERS study, which was in HIV infected women. And it was really an important study because it helped redefine the AIDS case definition for women, because women were getting different opportunistic infections. So it was, in the 90s, public health, it was kind of that was the thing that you would want to work on, I would say, to really make a difference. And so that was great. But then I was still like, we've been fighting for a different AIDS case definition for years, and it took us years and years and years. There's got to be a better way to do this. And so that was when I was like, okay, I need to figure out what is the next thing. How do you solve problems at least faster?
And then after the CDC, you moved on and founded Orange Sparkle Ball, which is an innovative and impact accelerator focused on moving public and private organizations' initiatives forward. I want to hear a little bit more about, because we spoke about earlier the social entrepreneurship and how important and impactful that has been for your life. And then you're working at the CDC. And how does social entrepreneurship kind of work itself into you wanting to found this organization?
Well, you might be surprised to find out that it wasn't it's not like I thought I'm going to be a social entrepreneur, because I had no idea what that was at that point. But I left CDC and I figured out there's this thing called industrial design, and it was about like doing something and then quickly testing it to see if it made sense to keep refining it and doing it again. And it comes out of product design. And I knew I didn't want to be a product designer, but this idea of designing something and testing it with the community that it's impacting, and then refining it and testing again and refining and iteratively testing and moving toward, what is the solution that's most effective, based on everything I had seen in my 7 years of public health. I was like, that is what public health needs. So I went into this program really to understand what the process looks like and how do you do it. And it was great. And again, I had this kind of like amazing, I found my people moment. And so I think that goes back to your initial, like, how do you define yourself? I'm like, I don't know if I call myself a public health person or a designer or some smash up of that, but that's really what I am. So I just started taking those classes because I was like, this to me seems like it's the missing piece that I was so, by the end of my time at CDC, I had seen enough really heartbreaking things, because I worked in HIV the entire time, that I just needed some different, I think I needed an emotional break to focus on how do you solve problems differently rather than that really hard problem. So anyhow, so I dove into this thing like, okay, iteration, this is amazing. I don't have to have like this huge hypothesis to start with. I can just go and be flexible and adaptable and know, collect little bits of data to see if I'm directionally going to the right spot. And I started doing that and started freelancing because, that was my MO. I'm like, I'll take a job. Great. And I started getting all these projects that were kind of half public health, and they started to be like designing processes, or is there a different clinic intake thing that we could be doing? How do we solve this problem? It was basically solving problems. How do we enroll people? Like one of my freelance things was a public health study that was having a lot of trouble enrolling people. And all I did was design recruitment posters that were well designed. Like, that's it. And all of a sudden they were like, oh, we got, we've enrolled everyone we need to enroll. I'm like, well, that was a pretty easy solution. But as I started taking on more freelance things, thank goodness, a friend of mine hooked me up with an accountant and was like, you really need to like be engaged with an accountant because you're doing all this freelance work. And as I started getting more projects, the accountant was like, you might want to incorporate. And I was like, I don't know what that is, but okay, you tell me, this stuff. And so she made me incorporate the company, and because she said it, was a protection and blah, blah, blah. So I became an entrepreneur kind of accidentally, just because it was, again, to the earlier conversation, it was being driven by market conditions. I kept getting more and more freelance projects. And because I couldn't do all of them, I kept needing to hire people to work with me on them, which is what led the accountant to tell me to incorporate. So that was my journey to social entrepreneurship.
Love it. And I like the idea that coming from the CDC, asking how can we do things differently, reading about industrial design, about design thinking, and thinking how can I use this to better the work of public health and moving forward in that. And then as you did that work and got your name out there and did more work, then you decided like, well, the clients and things kept on coming. And then as you spoke to the accountant, they're like, okay, you should really like make this a business, incorporate it, and then move forward from there. Before we get into like more of that like really initial freelance work that you did, what does feedback look like in a design thinking industrial design model?
Oh, that's a great question. That was not at all what I thought you were going to ask me. Amazing. Well, feedback, if you design, so now I call those tests, those sort of iterative tests, pilots. We typically call them pilots. and you typically set up some KPIs or key performance indicators around the pilot, they might be super simple. Like, can I get 5 people to engage with me in this process where I can watch them go through this? So sometimes feedback is, no, I actually can't get 5 of the folks that are the ones that will be using this process to do this. And that's pretty great feedback to get really quickly, because that's a real bad process. You're not solving anyone's problems. Sometimes it's, the feedback you get is, I just wanted to kind of watch 5 people go through this process, and I have 25 people who are saying that they want to do it because they think that's a better process than, the clinic intake that we're working on. And that's also really good feedback, because you're like, okay, either it's so bad that they're willing to try anything, or when you talk them through this, they actually think this solution might be better than the last time they did it. Often, you get somewhere in between where it's not this crazy quick failure or crazy quick success. And then we have gotten very rigorous about setting up our KPIs, which is just, metrics that are kind of quick short-term metrics. So what is the minimum thing? And this kind of goes to lean startup that kind of weaves in social entrepreneurship, but what is the minimum thing that would tell us that this is a viable thing that we're testing? And we set our KPIs to what would tell us this MVP is viable. And that might be, we've been doing a lot of autonomous. So we work across areas. So we work with industry, we work with academia, we work with the public sector. So we've been doing a lot of autonomous delivery pilots lately. That might just be that when you order something, you can select either person delivery or autonomous bot delivery, and 50% of the people say, yeah, they're okay with having a bot, or more than 50%. That gives you some directional indication that, okay, this might be a viable solution for delivering this specific whatever you're testing. Anyhow, did that answer your question?
It absolutely did. And I think it provides like tangible examples for people. And I like the idea of bringing it back to like the lean startup of like minimal viable product. What's the minimal viable effective thing that we can do to test to see if this pilot is effective, and then like, I guess, scale up from there or iterate. And I think that that's one of the big things that, like, while public health does a good job of evaluating things, I think the issue is like taking the feedback from that evaluation and then looping it back into the program to like continue to do things. That is a process that oftentimes is kind of slow, kind of lagging. And I appreciate you like bringing this up. And I think more of us in public health are being taught about design thinking principles, because I think it is a way to get in touch with the community. And many times the needs of the communities are changing and are dynamic, and being able to iterate is so important to ensure that you are meeting the community on the things that matter to them.
Can I challenge you on one thing?
Please.
Awesome. Right on. One of my things that I have a beef, maybe that's too strong, with public health about is this idea of being good at evaluation. If by being good at evaluation, you are rigorous in your evaluation and you statistically are rigorous with your data, blah, 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 blah. Great. Yes. I would argue that doing the thing for some amount of time, a year, 1 to 3 years, and then setting up year 4 as your year that you're going to do your evaluation is not being good at evaluation, because by year 4, whatever you started doing on year 1, all the conditions are different. So you're evaluating something that doesn't even exist anymore. This is when I don't make public health friends, but I would encourage public health folks to think of how are you setting up evaluations, incorporating, to your point, what you're finding works and doesn't work, and then moving into, is it a phased approach? Is it we do a lot of on the fly. So those KPIs that we're talking about are being evaluated throughout the pilot, and our pilots are never more than 3 months. If it's going to go more than 3 months, there has to be a reason. It has to be an extension. So we have to cut it off and have it be a real, like, okay, we are going to make a decision to extend this for X reason. So anyhow, just a little reframing about evaluation.
No, I appreciate the pushback, and I like that thought process as well. Because like if we would think about it, like from 2020 to now, and if you were going to have a program, and then on that fourth year you're going to like evaluate it or change things, like the world that we live in from 2020 to now is so different. And to your point of like having that process, that feedback loop be a lot quicker and a lot more substantive into what is going forward to then reevaluate as you iterate, I think is very, very important. So I will take that pushback, and I appreciate you sharing that.
Awesome. We can still be friends.
Oh, absolutely, absolutely. I think like it's important to have the pushback and the conversations, because we can't continue to do things the same way and expect things to be dramatically different. So it's really about how do we approach and take new ideas and bring it into public health so that we can support the work that we do to the best. So, yep.
Awesome.
Yes. So you founded Orange Sparkle Ball over 2 decades ago.
I did.
What was some
crazy? Yes.
So what were the initial services, freelancing? What did that look like, and how did that like continue to build up for you to get like to the point where you're like, okay, I'm going to start an LLC?
I talked about that. It was like this weird like hybrid research/design thing. Those were like my first projects that I was getting, and they were like super small. I mean, I was taking anything, I didn't have a job, so I kind of had to take anything that I remotely felt like I could do. And I didn't have a job. I was teaching a design research methods class. I had a teaching assistantship, but that's not really a job, let's face it. So I started taking, anything, and basically I didn't know it at the time and it didn't really exist, but I was doing service design projects, and they were typically around health related things. And now that, that's there are companies that only do that. But service design wasn't in its very infancy at that point. So people weren't even using those words together. And I was just trying to solve problems. So I was just like going in and saying, yeah, I know how to put a study protocol together, and I know how to figure out whether does that work or does it not work. So if I can do that, surely I can work on clinic intake, because that's kind of a similar thing. And, so a lot of those were the initial projects. But I was also in industrial design school, and that's very product design focused. So I started kind of dabbling in product design just to kind of go through the process. I was in it very much like I want to learn. And the beauty of product design is you learn a ton about visual communication. And that is a hugely valuable skill. I can't say enough about how important visual communication is in every area, whether that's information hierarchy or signage, So I started doing some product design projects that I got, and I ended up designing 300 SKUs. Those are individual products for the opening of a very large food and beverages store, which was kind of accidental, but it also was fantastic because I learned a ton about production. I learned about working with global factories, whereas I had worked globally before. I was working typically with hospitals or universities. And so I learned about globally working with industry, which was great. And so I just started kind of putting this process I was learning into practice in anywhere I could. And I learned and learned and learned and learned. And that ended up being a really valuable thing. And also UI UX was kind of starting at the time. And I had a lot of data experience. Clearly, I had programming experience. It was more statistical analyses type programming, but I knew my way around code. And so we also started building apps. So they were typically web-based at that point to do something. So it might be to store one of the initial projects we had a long time ago was storing project data from different research projects and then comparing, actually there's some similarities, comparing budget with kind of the results of the project, very similar to my first budget negotiation. We built that as a database application. So I kind of started just piecing together all the various skill sets I had and trying to implement this iterative process I was learning in all the places that I could, and just learned a ton.
And since then, you've done a lot of work. What does a lot of the projects and work that Orange Sparkle Bowl do? What does that look like right now?
Thank you for asking that. We've gotten very specific about the type of work that we do. And I also, my thinking has matured. Different sort of areas of thought have matured. Like I said, service design didn't really exist as a thing. Service design has matured. We work in innovation, and I have similar. My definition of innovation is almost the same as my definition of public health, which is everything. No, I think innovation is about making positive change, period. I don't, sometimes people get into like, is this transformative innovation? Is it process-driven innovation? I don't really care. If we're making positive change, I'm happy with that. So to answer your question, we now think about 4 layers as we're thinking about activating change. And the top layer is all about understanding the community or the ecosystem. So that's the kind of, what are all the factors that go into why this is how it is now? And if we wanted to understand some of the levers that we might be able to access to make change, that helps us understand them. The next level we think about is designing a program or a platform for the change. And that's really a roll up of a lot of those iterative pilots that I talked about earlier. And when I'm talking about pilots here, I'm talking about the 3-month version, not the, sometimes our public health pilots are 3-year versions. I am not talking about them. And then, so if you have ecosystem, platform, or program, then you have pilots. Sometimes people just call those projects if they work in an area where pilot is used for a 3-year thing. And then people. So understanding what those people who are trying to create change, so those innovators, what support do they need? What are the characteristics of people like that? If it's in a corporate environment, they're often entrepreneurs. So they're entrepreneurial, but within the confines of an organization. And if you approach all your projects understanding those 4 layers, you start off on pretty good footing. You might enter at a different one of the layers. So like right now we're working, I have my Detroit sweatshirt on. We're working with the Detroit Regional Partnership to map the mobility ecosystem in the Detroit region. And by that, I mean collect data about it and analyze it to really understand using collect data and analyze it using social network analysis to really understand what organizations are the key players in the mobility ecosystem and then what organizations might serve really important groups in the region, but are not necessarily super integrated into the ecosystem. And once we understand that, we can then help support, because they've come in and they already had a program. We can help support them building out their program with precision interventions, pilots that pull in, for instance, some of the organizations on the outer part of the ecosystem, but maybe they serve really important constituents. So they might serve, the elderly who need help with mobility. Can we attach a program that this organization that serves, a group that needs mobility with this organization that has a lot of influence in the ecosystem and pull them in? And that would be truly understanding the ecosystem and designing a precision intervention. So that's an example of how we think about those layers in a project we're working on right now.
Well, I appreciate you sharing that. That definitely helps, given that visual of community ecosystem to program or platform to pilot to project to people, and understanding that those are the layers that we have to like work with and impact with, and that's like the model that you all are using to make this impactful change. And I feel like that is helpful in itself for a lot of people in public health. So I appreciate you like just laying that out and sharing a lot about the work. I did want to ask about the visual communication aspect of things that you say is so important and that you've learned from industrial design, product design. So what are maybe some tips or some advice that you give to people around visual communication?
Absolutely. I have a lot of thoughts. So all of our projects involve wraparound communications. So this morning I had a meeting about some precision intervention projects that we're working on, and we have in our project flow, we have built in communication pieces, and we have them, kind of labeled as documentation, but they're very specific. So at this point in time, we do things, the output of them is both for a case study as well as for a program roll-up, but also they go out on social media and they're given to all of the partner organizations to put out on social media, because that basically helps everyone in everyone's ecosystems, because we all have kind of our own network, understand that this is a valued project that all of the organizations are focused on. So it's sort of communicating the importance of trying this new process. So we have built-in comms, we have built-in case study for this pilot, and then we have built in that all of those case studies roll up to the impact for all the pilots, because all of those, and those are all of those communication pieces are just at the beginning of the project. We know they will be distributed to every organization who's participating in any of the pilots. And so that's a very simple one, but it's proactively planning rather than in a reactive thing like, oh, we have a result, we're going to throw that to the comms team. It's not that at all. It is at every stage, how do we build this in? So that's like one example. Another example, and I feel very strongly about this, but there we go. I really believe in dashboards. So I have this Apple Watch and my circles yell at me if I have not completed them. So I'm getting constant feedback throughout the day as I am typing or whatever, like, ooh, I better get out and walk because I have not done what I need to do. You can reinforce a whole lot of things with just making the data very visible. And so we do a ton of dashboards, and we try to build a dashboard for every group of pilots that we run so that people can see progress. And that is a very big motivator. It also gently nudges other folks that are maybe not necessarily getting on board in the way that we want them to with data, because they can see, there's a little bit of, we use FOMO quite a bit. Oh, those people are participating in this thing and they're getting all this attention and it's cool and they're doing all this cool work. And we're over here, waiting until we have some result that we can toss to our comms group. So anyhow, I think anything that you can do to make the nuts and bolts of what's happening visible to as many people as possible is really important for change.
I love that. And I think we miss that a lot of the times in public health and like nonprofit work, just that communication part. And like communication is part of the work in itself. And it's not something that's like quote unquote separate. And knowing that you have to communicate everything as you go I think that is the most impactful way to do it. It's like building in public type of thing, and like just letting people see this is what we tried, this is what happened, this is what we're going to do now, and just like showing them as they're going along, like telling that story. I think is something that we miss too often.
Well, and to that point, and everyone misses it. It's not public health specific, so it's not. I think we want to think we're in our work, and then when we're done. Like, I think we all as humans have this sort of fallacy that the work will be done at some point. The work is never done. But we think when it's done, we are then going to prepare this like perfect report or something, and we'll give it to people and everyone will want to read it because of course everyone wants to read it because the work is done, but then there's no there. But one of the things that we do, we run a lot of, I think I mentioned this earlier, co-development sessions with the community. And one of the rules that we have, and sometimes people get, clients get nervous about this, strangely, we always put together some sort of result from every co-development session and we distribute it to everyone who's participated because we're all in this together coming up with these ideas and everyone owns them. Like here, we want everyone to have value from this. That, strangely enough, is sometimes makes people very nervous. I don't understand it, but that's a very simple communication thing that you plan before you do anything. You have no idea what's going to come out of the co-development session, but you already know you're committed to putting it out to everyone who participated. So that's a very simple version of like proactive communication and planning that just makes you be a good partner. I think it's how you're providing value. You're not extracting value only. You're also providing it, I guess is maybe a better way to say it.
Yeah, absolutely. Well, I appreciate you sharing that. Before I move you on to the Furious Five, very quickly, while you've been the founder of Orange Sparkle Ball, you've also been the founder of Spark Corps, as well as a steering committee member for Evolve Innovative Network. Can you just briefly touch on those?
For sure. I knew that I wanted to figure out, so I talked about we work with a lot of students in a lot of different college programs and undergrad and grad. And I wanted to figure out how we provide, it was kind of an apprenticeship program for using design thinking to make impact. And like, could we get people up to speed on basically being change agents really quickly? And so I wanted to start a nonprofit, and I think I started it in like 2015, and it ran through the beginning of the pandemic. And it was great. We had several cohorts, I can't remember at this point how many cohorts, but of apprentices who came in and typically worked from between 3 months to 12 months. And we would integrate them into projects, and they would, it was basically like hit the ground running. You're in it. There was a lot of, we presented to city council in Atlanta. We went to Toronto and put on an exhibition. Like it was pretty, we actually did the exhibition in a bunch of other places too. It got picked up but it was trying to remember how I talked about, like, I was very young and was thrown into these negotiations, and it was great because I learned a ton. I wasn't necessarily prepared, I didn't think, but I learned a ton. It was kind of trying to approximate that, but with I think everyone, think everyone was a design student, but some design thinking, kind of real world, let's make change training. And it was good. I think I wanted to explore the idea of a nonprofit and understand more the drivers there. And so it was great also for me to understand nonprofits and why you would do that and why you wouldn't do that is probably more accurate. But it was really reliant on being in person. It worked great in person. And then when the pandemic hit, it was very hard to take, just out of school designers and expect them to be remote and also like, okay, now prep to present to city council. It was a lot easier to be in person doing that. And so we decided to make the decision to shut the program down when it became clear that we were completely distributed now, that we were probably never all going to be in the studio together. But it was, I think, a very good learning exercise. I don't see the benefit of being a nonprofit other than as a tax thing. So it was kind of my counterpoint to, okay, I get social entrepreneurship a lot and I really believe in it. This whole nonprofit thing, is that a good thing to do or not? The social entrepreneurial thing continues on, the nonprofit shutdown. I'll leave it at that. But I think it was great. It was a really good learning experience, I think, both for the apprentices that went through the program as well as me and some of my colleagues. The Evolve Innovation Network is something that also evolved during the pandemic. And we're still kind of trying to sort out what is the way to do it. But what we started doing right before the pandemic, and it was kind of unfortunate timing, I think, is getting innovation, people who are doing innovation across sectors. So our ideal scenario was to get public sector, academic, and industry folks all doing innovation in a room to understand that this innovation thing, making change, is really hard and it's emotionally really burdensome. And we laugh sometimes about innovation therapy. You can talk to other people who are trying to do it and it's really helpful. And so that was sort of the premise of Evolve, like let's evolve our thinking and understand that the innovation work you're doing when you're a quick service restaurant takes the same skill set as the innovation work you're doing when you're in an academic institution. Like people, I think, it's just like CDC had been, and I think is somewhat still, but really designed around kind of what disease you're working on or what chronic condition or whatever. And it allowed people to get very passionate about kind of their focus area, but didn't really allow them to understand I'm using the same skill set here that I would be using if I was working in environmental health. I'm just working, at that point I was doing HIV research instead of environmental health research. And I think when we're in silos like that, we forget to connect the dots, as I have talked about. And that's to our detriment, not to our benefit. And so Evolve was trying to get people in different areas of innovation to have those conversations around, oh, hey, that's a problem I have too. I didn't realize that you, the public sector innovator, and you, the quick service restaurant person, actually are trying to tackle the same problems. So that was the premise of it. It worked great. We had an amazing event in DC. That was our kickoff event, and it was the last work travel that I did before the pandemic. And so we pivoted to some online stuff. And now we're just trying to figure out, that layer that I talked about, people, like what are the skill sets you need to be a change maker, and how do you support people who are, you get smashed down a lot when you're trying to make change. It's not an easy emotional place to be. So I think I would say our thinking is still, we're trying to figure out how to solve that problem of helping people connect dots across the sectors for support.
And last question before I actually move you on to the Furious Five. What do you enjoy most about being the founder of Orange Sparkle Ball?
Well, I really like not working for anyone else a lot. That is great. I really like. So I talked about those layers that we focus on. I just got out of a meeting where we are talking about understanding the ecosystem, and most people right now are, when you talk about understanding the community or the ecosystem, they'll put together in sort of community lingo, it's like a resource directory or a list of organizations that provide services. In more like entrepreneurial ecosystems or innovation ecosystems, they might talk about like mapping the ecosystem, and that's basically a list of organizations, and they might be categorized by something. So these are entrepreneur support organizations, these are, funders, these are, some provide some other database support or something, or services like legal. Anyhow, being the founder allows you to say, that's great, everyone is doing some version of resource directory that doesn't really get us anywhere because it's a point in time list. That's all it is. How do we understand how this ecosystem actually functions? Because we all know every network is a live organism. It changes. Like, I could understand it right this minute, and in 5 more minutes it's changed. And to our earlier conversation about evaluation, like from year 4 to year 1, we know that things change constantly. So understanding kind of who supports a network, who are the influential players in a network, and if we need to direct resources to specific areas, how do we precision intervene, is something now I'm really interested in, but allows having the latitude, I would say, to say, this is sort of the standard right now. It's not enough. Let's push into how do we really understand this? If I was working for somebody, I would be having to pitch that. And instead I can say, like, I can see the holes in that right away. We are not going to do that. We are going to push into how do we get better? How do we understand more? How do we get more relevant data right now that is actionable so that we can precision intervene? So I think that's my biggest, that was a lot, but that was my biggest thing about, I really like being able to push into let's be better.
Love it. Appreciate you bringing it up. And wish we had more time to continue this conversation because I feel like there's so much more that I want to learn and hear from your perspectives, but we do not, unfortunately. And I have to move you on to the Furious Five, the 5 questions I ask all guests.
I'm nervous about these questions. I read them and I was like, oh, okay, I'm ready.
I believe in you. I believe in you. You got this.
Thank you.
You're welcome. So number 1, what advice would you give to a student trying to pursue a career in public health?
Well, I think that the fact that I could walk across the street to CDC and talk to people that worked at CDC was huge for me. So whatever is the thing that you think you want to do, whatever drew you to public health, find the people doing that and talk to them and be very honest. Like, what do you do? Do you like this? What does it actually mean to do this? And so that's one thing. Like, you can't get that from Googling or, doing literature review or all the more removed things that people want to do rather than talk to people. So that's one piece of advice. And then my other piece of advice is constantly challenge what are the borders of public health, and be ready to think public health is much more expansive than we might be presented.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Take risks. You got to take risks. if you don't have a tolerance for taking risks, then you recalibrate where you want to be. Or, I mean, there are lots of places you could be, but that's all I have to say about that, I think.
Number 3, what's something you are working on improving in your life right now?
We're doing all of this network analysis, and it's been making me think a whole lot about my personal network. And I don't mean like networking. I mean, what are the influential relationships in my life? And how do I nurture those, and also letting those people know that they have been very influential relationships.
Number 4, professionally, do you recommend anything?
I think I'd go back to take risks.
Yeah, makes
That'll
sense.
get you. I mean, I think huh? You got to put yourself out there, and it can be a disaster, and that's okay.
That's part of the process.
It really is. Yes. Can I ask
And
you
then
a question? Oh,
yes.
Sorry. I'll wait for my question at the end.
Okay. Number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
This was the one I was like, ooh. I think I tried, when I went into public health, I tried to understand like what I should be as a public health professional. And then when I went into design, I was like, I don't know how these two things are. I need to make these things fit nicely together. And what I realized is the conflict is the beauty. So the fact that sometimes things don't fit so nicely together is where new things happen. So embrace the conflict, I would say.
Love it. And I'm ready for your question.
All right. So clearly you are a social entrepreneur, and a public health social entrepreneur. How did you make that decision?
It chose me. I saw that there was a gap in understanding public health, in having information that was accessible and made sense for me. Because all the time during my Masters of Public Health, that I was trying to figure out what I wanted to do in public health, and it was very challenging to get that kind of information. And then I was able to get a fellowship after, like before I graduated from my Masters of Public Health, and I felt that I learned so much from going through that journey and understanding how to go about navigating the public health landscape. And it's just come from a place of wanting to give, and it's just grown into more, as people have said, this has been very helpful, or like, I really appreciate you sharing this, and those kinds of things just wanted me to like dig deeper and reflect on what has helped me get where I am now, and then continue to share that. And it's blossomed into this podcast and having wonderful guests like yourself.
Awesome. I wanted to ask you earlier, so thank you. And then my only other thing I would say is, how we talked about proactive communication and we build that in? I know you have just launched that platform. So if you send us communication assets, we will put it out to our network as well, just because I think it's really important. That thing I talked about providing support to people who are trying to make change is core to all the work that we do.
Well, thank you so much. I'll be sure to share that with you, and I appreciate you taking time to like come on, share your expertise, your insights. It has been a lot of fun, and I think it's a different perspective that we typically hear, and I think that's important to hear.
Awesome. Well, thank you for having me. I'm really honored you would include me in a public health thing. I think, as I mentioned earlier, I don't necessarily fit perfectly anywhere, and so thanks for letting me be a public health interloper.
Thank you so much, Meaghan, for coming on. And it has been amazing to hear your story and outside of the box of public health, and just really like giving to us, I think was very, very helpful. So housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Share it with a friend who get value from it, and leave us a 5-star review. Thank you all so much. See you all next week. Peace.